I am Dr. Vivek Vij. I am Chairman and Director Liver Transplant and GI Surgery at Fortis Group of Hospitals. So what are the risks attached with liver transplantation? So there are many risk factors which are attached with liver transplantation. These risk factors define the success of liver transplantation. So to understand the risk factors, we must know the success of liver transplant. Liver transplant, generally speaking, is successful in about 97 to 98% of cases. It means we are able to discharge 97 to 98 patients out of 100 from the hospital after liver transplantation. But still 2 to 3% of patients, they lose their life after liver transplantation. And there are many risk factors which define the severity, which define the outcomes of liver transplantation. Three of these risk factors I must enumerate. The first risk factor is severity of liver disease. If your liver disease is very severe or of a higher grade, which is calculated by MELD score, MELD score, which includes bilirubin, INR or creatinine levels, then of course chances of success are slightly less. Second factor which is very important is, are there any other diseases which are affecting your body, or these are called as comorbidities in the form of in medical terminology. These comorbidities may be heart disease, these may be kidney disease, these may be any other organ system involvement like diabetes, hypertension, heart disease, kidney disease, lung involvement. If all these problems are present, then of course chances of survival are slightly less. Third factor which determines the liver transplant outcomes are the condition of the patient. So what is the condition of the patient at time of liver transplantation? If the patient is very stable, roaming around and coming from home for a liver transplantation, of course the chances of success are very high. But if the patient is admitted in the hospital, especially in the ICU, requiring multiple antibiotics, requiring other supports, renal support or other support, has problem with the lungs, has problem with kidneys or brain, then of course chances of success are slightly less as compared to a patient who is very stable patient.